Okay, my last speech didn't turn out. My recorded in really fast beats, so we're going to try this one more time. I'm Denise Pfeifer, and this is my Communications 110 informal speech. Ba-bum, ba-bum, ba-bum. Can you guess what that is? It's a heartbeat, and I'm probably going to make many of your hearts beat a little faster with the speech I'm going to give you this evening. As most of you know, I am Denise Pfeifer, and I'm going to tell you about heart disease in women. According to the American Heart Association, 1 in 4 deaths in women each year are due to heart disease. That's an average of 8.5 million women a year. This number makes up 1/3 of women's deaths in the U.S. Dr. Elvin Silverstein defines heart disease as any disease affecting the heart. It's not just one disease, but a number of heart and blood disorders. One common form of heart disease is heart arrhythmia. This is a constant change in heartbeat causing most sufferers to experience dizziness, out of breath, or sometimes even chest pain. About 6 months ago, I was diagnosed with this disorder. I have a history of congenital heart failure in my family, but not this. 2 other forms of heart disease are coronary artery disease. This is when the arteries harden and become narrow. This normally leads to a heart attack or angina. The other is heart failure. This is when the heart can't pump blood to the body as it should. Heart disease can affect women of any age. It can strike elderly, middle-aged, young adults, teens, children, and even infants. 2 categories of women are at higher risk. Those are postmenopausal women and women taking any form of birth control. Unfortunately, estrogen replacement therapy does not lower this risk for postmenopausal women. The number one reason why most women who have heart attacks die from them is that they wait longer to go to the emergency room than men do. They feel like they are experiencing heart attack symptoms, but they don't go. It doesn't help the matters that doctors are often slower at recognizing the presence of a heart attack in women because the characteristic pattern of chest pain isn't there, and an EKG normally doesn't see the changes in the pattern aren't noticed as quickly. That means that you need to know the warning signs yourself. Some of the warning signs are abnormal heartbeat, tiredness, dizziness, shortness of breath or lack of air, nausea, and chest pain. According to the American Heart Association, however, 2/3 of heart disease deaths in women occur because the women have experienced chest pain and thought the nausea was simply indigestion. According to Prevention magazine, women often experience different symptoms like heartburn, loss of appetite, tiredness and weakness, shallow coughs, and heart flutters, which feel like palpitations in your lower throat. This was my warning sign. 71% of women just experience extreme flu symptoms when they were actually having a heart attack. The good news is that women who catch heart disease early can live with it with proper treatment. Lifestyle changes like diet and exercise is one way. The other is medications like I do. I treat my disorder with metoprolol, which I take daily. Sometimes surgical intervention is necessary by having a defibrillator or a pacemaker implanted into the heart. According to Prevention magazine, a woman's heart responds better than a man's heart to simple lifestyle changes that I stated previously, and this is good news. Now I'd like to grab your attention a bit more with some heart-jerking numbers from the Center of Disease Control. Did you know that 8 million women in the U.S. are living with a form of heart disease, and 35,000 of those women are under the age of 65? I didn't know that. 42% of women who have had a heart attack died within a year. Now let's compare that to the only 24% of men who have that fatality rate. Under the age of 50, women's heart attacks are 2 times more likely to be fatal than a man's. After age 50, men and women have the same fatality rate. And lastly, 6 times more women die from heart attack than breast cancer. The awesome news that comes from all that is that being informed has made a difference. According to Dr. Elvin Silverstein, the number of deaths in women and men from heart disease is starting to decline each year and is continuing to decline. Some of this is in part due to support from the American Heart Association and the Go Red for Women campaign. This campaign is made up of a group of women, researchers, and doctors who are dedicated to making the numbers drop even more. Their goals are to educate and inform women on the risks. They support research and advancements and teach women about prevention practices and tips. They also offer the Go Red campaign, which is a Better You body makeover. Anyone online can join. I already have about 2 weeks ago. This is a makeover from the inside out. It allows women of all ages to participate in the national 12-week program that teaches them your lifestyle changes and guides you through a goal-making process to make these changes. They also offer online coaching and online journal as well as weekly and daily tips to to help you even more. Just go online to join. You'll be glad you did. I'd like to leave you with some food for thought. First off, there are a few things that you should know when you go to see your doctor. Number one, don't just think shortness of breath is simply anxiety. Yes, anxiety can cause shortness of breath, but not being able to catch your breath is a sign of a heart or a lung problem. Number two is your normal HDL, which is your good cholesterol, is usually 60 or should be at that level. But postpartum women who have already experienced maybe post-menstrual are also having a borderline number. That means that they should be having a CAT scan with calcium scoring to detect plaque or blockage that is not showing up in the tests. And finally, number three is don't think you are fine because your doctor says your major arteries are clear. Most women who have heart disease have trouble with their small interior arteries. This kind of blockage is only detected by having a nuclear stress test. Lastly, I'd like to make sure you know the risks that you can do yourself to lower and prevent heart disease. According to Prevention Magazine and Women's Health Association, these risks are a lack of exercise. Just keep moving. Walk upstairs instead of the elevators or park a little farther. Or just play with your kids. They'll love you for it. Smoking is also a risk. Most women who smoke die 19 years earlier than women who don't. Obesity is a risk. Check with your doctor on what your ideal weight should be. Everybody's body makeup is differently and so is their metabolism, so your doctor can help you find that perfect number. Another one is that you can lower hypertension or blood pressure, sometimes with medication, sometimes with diet. Another thing you could do would be lower the fatty foods you eat. This is a way to have your family start healthy habits of eating that your children will carry on to their families. And of course, you should lower your stress. It also helps to know if you have a history of diabetes or are at risk for diabetes yourself. Just stay informed, simply, and be aware of your body and make the choices to not be a statistic. Keep your ba-bum, 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 taking healthily for a lifetime. Thank you.